A nasal spray based on ketamine is set to become the first new medication for depression listed on the PBS in 30 years. Consulting psychiatrist and University of Sydney Research Fellow, Associate Professor Elizabeth Scott joins us now with one of her patients, Alexis Hutchin. Good morning to you both. Wonderful to talk about this development.
Good morning. Good morning.
Elizabeth, tell us, what is this treatment? Because people might hear ketamine, they might not have heard of this before. How does it work?
So this is very welcome news for people in Australia living with depression. We've known for a long time that ketamine has an antidepressant effect. It was originally used as an anaesthetic. It's used a lot in chronic pain treatment, but anybody who's abused ketamine will know that it has mind-altering effects. So we've known for a long time that it's a very effective antidepressant. It works very quickly, which is different to other types of antidepressants currently available that work on the serotonin system. The difficulty with ketamine is that it's been hard to access. It has to be administered intravenously or subcutaneously, and that has really made its access very limited and expensive.
And Elizabeth, when might patients turn to this type of treatment? Is it after they've tried different other types of treatments that haven't worked?
Yeah, so esketamine, which is a form of ketamine, which is an intranasal spray, is approved for people with treatment-resistant depression, which is difficult to treat depression. So it's not for everybody. You can't walk into a pharmacist or a GP and say, I want this drug. It's really going to be limited to those people who have had depression that has not responded to standard antidepressant or psychological therapies. So it's going to be really something that you have to do in association with specialist kind of psychiatric assessment and appropriate monitoring.
And Alexis, you've tried the drug. How are you going?
I've been on the drug for about 3 years now. Compared to how I was prior to taking esketamine, I'm back to work. It was really about getting back to functioning and just being able to live my life the way it was, prior to being diagnosed. Oh,
that's wonderful to hear. And what would it mean to you now that it's on the PBS? Because I think it costs around $31.60 now, which is not too bad, right? It makes it more accessible for people like you.
It does make it more accessible. However, there are other costs involved with taking this medication. We have to pay for multiple clinicians. There's a lot of monitoring involved. In the clinic that I have it, I take the treatment at, is, we're in our own room, so there's room costs for the clinic, and that comes out of our pocket as well. So it is an important step forward, but it is still costly, and there will be people, especially young people, who still won't be able to afford those costs.
All right, still inaccessible for them. Well, it is an important development. Professor Elizabeth Scott and Alexis Hutchin, thanks very much for joining us on the program this morning.
Thank you very much.